Hoki mai Arnold, welcome back. GPs and pharmacies have been given more powers to help ease the pressure on the health system this winter.
The government's making paracetamol free for children at pharmacies, and virtual healthcare is being expanded. Zane Small has the details.
With winter on the way, general practitioner John Cameron fears for our under-pressure health sector.
We've been asked to do more and more and more, but the money and the time doesn't come with that. We have a health workforce crisis.
The government's announced its 2023 winter plan to try and alleviate that strain and improve on last year's failures.
People did have to wait for care too long, and we want to improve that. That's what these measures are designed to do, let people get care in the community so they don't need to be in hospital.
Complementing the flu and COVID vaccine rollouts, from June, GPs will be able to refer patients to an expanded range of radiology scans to avoid hospital admissions. They're aiming for more accessible after-hours care, and hospital-in-the-home services like virtual monitoring and consultations will be expanded.
Over COVID, we learned a whole new different way of doing general practice. It doesn't actually require the punter to have their bum in the seat anymore.
Though locals we spoke to in rural Tikawiti weren't too keen on the idea of virtual consultations.
I can't be bothered with it. No, I don't have grandchildren around to do it for me.
Like if I go in and I'm sick with the doctor, I want them to check my body out, not just have a picture to go off.
The government also announced today that from June until September, paracetamol and other treatments for minor ailments like gastro will be free at pharmacies for Māori, Pacifica, children under 14 and community service card holders. It's welcome news to Waimarama Anderson, who has a 4-year-old son.
It'll definitely help, especially with our economy these days, eh?
Pharmacies will also be entrusted to treat minor ailments, but Dr Cameron is concerned they don't have the expertise to recognise signs of more serious illnesses.
I have a little bit of a concern that if the knee-jerk response is to the pharmacy paracetamol without any additional processing around that, that's probably not the safest things for kids.
Yeah, I'm pretty confident that pharmacists as health professionals actually have an enormous amount of experience.
Experience the government's calling on to help bolster the fight against winter illnesses. Zane Small, Newshub.